Okay, I am going to be going over the female GU exam. First, I would gather all my supplies I would need for the exam. Then I would help place my patient in the lithotomy position. Um, then I would do an external examination of her vagina, and I would be looking at the mons pubis, the labia majora, the labia minora, the clitoris, the urethra, um, the uh, um, anus, the perineum, and the intraosseous or intraosseous. Um, but before I actually inspected that, I would place my hand on her knee and move it down her thigh before and tell her before I touched her vagina to inspect her external genitalia. And when I was looking at all of those structures, I was looking for any. I looked for her hair displacement or hair placement and growth, and if there are any nits or lice within her hair. I also looked for any erythema, warts, lesions, or bruises, or lacerations, or abrasions. So just and I was also assessing if there was any abnormal discharge or a foul smell. Then I would move on to the speculum portion of my exam to prepare her for a pap smear, and I would get a speculum that's been warmed with warm water, and also lubricated with water. And I would insert one finger into her vagina with downward pressure to relax the vaginal walls. And I would insert the speculum at a 45-degree angle and then turn it horizontally with a downward motion. And I would open the speculum, and when I found the cervix and the cervical os, I would lock the speculum open. And then while I would look at her vaginal walls, and this would be the time where I could get a posterior lateral swab of her vaginal walls if I saw discharge or I wanted to do a wet mount. I would also be looking for chlamydia and gonorrhea, or this is when I could test for chlamydia and gonorrhea if I saw any abnormal discharge or had a if I suspected that. Then I'm going to move on to the pap smear portion of my exam. And with the spatula, I'm going to scrape the squamous columnar junction. And then with the cyto brush, I'm going to do the endocervical, I'm going to swab the endocervical area to get the pap smear and the cells I need to do the pap smear. Once that is completed, I would unlock my speculum and pull it out. And once I don't see the cervix, I'll close it, and I will try to visualize the vaginal walls on my way out. And when I'm pulling the speculum out, I'll apply downward pressure to ensure optimal comfort for my patient. Now I'm going to move on to the bimanual portion of the exam, and this is where I will insert two fingers into my patient's vagina that are lubricated, and with the other hand I will place it on her abdomen. And when I'm inserting my fingers into her vaginal wall, into her vagina, I'm going to be assessing her vaginal wall and the structures and tone of her vaginal wall. Then I'm going to locate the cervix and the fornices, and I'm going to wiggle the cervix and see if there's any tenderness with that CMT. And then once I'm done with that, I'm going to push down with my other hand that's not in her vagina on her abdomen to see if I can palpate the uterus. Then from there, I would attempt to palpate the left and then the right ovaries. Once that is done, I would take my fingers out of her vagina and get new gloves if I was going to do a vaginal rectal exam if it was indicated. Um, if it were indicated, I would ask her permission if I could do it. Um, if uh, if it's not indicated, that would conclude the GU female exam, and I would give her some tissues, let her clean up, and then step out of the room so she can get dressed, and then I would come back and discuss any findings or if she had any questions.